Hello everyone. Today we're with Brenda 4 days after surgery. So she had her surgery last Friday and here we are Tuesday, just 4 days post-operatively. Brenda, we want to hear a little bit about your experience over the weekend. How did it go after your surgery? What do you wish you had known and what were you prepared for, and just your overall kind of experience?
Okay, so as he stated, it's been 4 days. The first day was pretty, just went home and slept, was kind of out of it. The next morning when I woke up, I felt very, awake and was able to move around. I didn't have a lot of swelling actually, and the bruising had not started really either. And I looked my skin was very tight, and it just looked really good. It was very exciting. So, and there's a lot of numbness on the whole ear sutures and everything like that. And it took a couple days for me to be able to bathe. I took a bath and just lightly put my hair in the water, but was able to do that without difficulty, and made sure I dried everything with the blow dryer gently with a brush and everything. Right. But then, then you start to feel more like yourself. And that was, I think, 2 days after the procedure. I had a lot of energy. So my personal problem was more staying still than not staying still. But I think I mentioned that one of the things that really stood out was the eating. So eating anything that had any resistance, you could feel it because I'm assuming you've done something with the muscles and pulled them all back. Mm-hmm. And so using those at all was painful and felt kind of like a sinus infection or something. Nothing that the medication could not handle. Sure. But I would advise anybody who gets this procedure that they give themselves like a 2 to probably 4 day window of doing canned soups and maybe like Greek yogurt, the protein that's a good option.
So like soft foods, because
very soft.
We are working over one of the major jaw muscles that we use for chewing is this masseter muscle on the side of the face here. And so as we're looking at Brenda here now, so we're seeing some bruising. This is pretty typical. Generally we like to have patients on arnica prior to surgery, and then Brenda's using topical arnica cream over the bruising areas. We're going to give this about 7 to 10 days, and then when she does her follow-up next week at this time, if there's any residual bruising, we're going to zap that with a laser just to kind of expedite the resolution of her bruising. But as you can see, her incisions, which we just cleaned, are healing very nicely all the way around, and then it's behind the ear here. So you can see here, just this area, everything is looking good. And we're seeing, obviously there's going to be some swelling in all the areas that we worked, but at this early juncture, we're only 4 days post-op, we can already see a more developed jawline, a lot less jowling, a little less in the nasolabial. And so one thing that we'll commonly do, we might add a little bit of filler in this little triangular spot here, 1 to 2 weeks after surgery. Certainly, Brenda, we did a little pinch excision of skin from the lower eyelid, which is quite common because we've lifted this up. We've recruited that lower eyelid skin, so there was extra, just a little pinch that we removed, so she has a suture line there as well. That's what's caused the bruising in this area of her cheek, is the eyelid surgery. Had we not done that, likely she would have no bruising here, and most of the bruising would be just limited to this area of the neck and side of the face. But I think really at 4 days, things are looking really, really great.
Yeah, and I'm also starting to get sensation back because of the incisions. I think that you just kind of are numb. But now I'm starting to feel some heat, a little bit of kind of warmer cheeks, and then the itching is probably the most noticeable. And then I'm feeling pressure, like it's almost like a sinus infection or like a
tightness.
Yeah. So nothing that pain medication hasn't been able to manage at all. I'm actually not even taking any of the
Percocet.
Yeah, I'm just doing Tylenol. And I have had no problems with sleep. Nothing has been problematic in that way either, as far as irritating or pain. So it's been actually extremely easy to get through this process. The only things I would stress is making sure you've got enough facial ice, system in place, and then soft food at this point. Yeah.
Excellent. There's Brenda, 4 days post-surgery, and we're going to get another update a week from now, so she'll be post-op day 11. We'll work on any of the bruising that remains at that point, but the hope is to get you back to work for a new job that you have coming up next week. So yeah. That's great timing. Some people do this with a little more leeway, Brenda being the person that she is. Pushes it right to the limit.